Hello, I'm Young Han, and this video is for wound care, applying a wet to moist dressing change. So before entering a patient's room, you want to knock, and then upon entering, close the door, the curtain for privacy, and then perform hand hygiene and introduce yourself. Hello, my name is Young, I'm your nurse today, and I will be cleaning and dressing your wound. So in a real life situation, I would also confirm the patient's identity by checking their wristband and asking them their name and date of birth and making sure the information matches. I would also have assessed them for pain and medication half an hour beforehand, as well as check the doctor's orders to make sure of what supplies to use, as well as gathering those supplies. Alright, so first I want to set up my workstation by wiping down the table and then setting up the garbage for any disposal of dressing. Alright. And then I would also perform hand hygiene again and apply clean gloves. This is also when I would make sure that the patient is positioned appropriately and comfortably for the procedure, depending on where their wound is. In this case, it is their leg today. And I will also put down a disposable pad just to catch any irrigation runoff or wound drainage. Alright, so first I want to take off the dressing of the old dressing, and that will be, first I'm going to loosen the tape, and I'm going to do that by stabilizing the skin and then pulling the tape up in the opposite direction very gently. Alright, and then when I pull up the dressing, I'm just going to continue pulling off the layers, and I'm going to grab it by the corner and try to avoid touching the wound as much as possible. I'm also going to assess the drainage on the old dressing. So the abdominal pad is dry with just a little bit of serosanguinous drainage, and then the sterile gauze pad is moist with some serosanguinous drainage, and it's about maybe 25%. Alright, and then the fluff gauze for packing is fairly saturated, so there's a moderate amount of both serosanguinous and sanguinous exudate. It's like 75%. Alright, next I'm going to irrigate the wound. First I'm going to remove my gloves and perform hand hygiene and apply new gloves. Alright, and just a note, all the packages that I am opening today, in real life they would be unopened and sealed and sterile. So when irrigating the wound, you want to make sure that the saline and the tip of the catheter and the tip of the syringe all stay sterile. So I'm gonna open this. Alright, for the catheter, we want to make sure to only touch the blue plastic area, and then same with the syringe. When screwing on the catheter, you want to make sure to not touch the tip of the syringe. And I'm going to pull about 20 to 30 milliliters of sterile saline solution to irrigate the wound. And I want to go from clean to dirty, which means that I'm going to start in the middle of the wound and just use a steady stream to irrigate the wound, making sure to avoid getting the outside of the wound until it runs clear. And let's say that it is running clear at this point. Dispose of that. Alright, and next, using sterile technique, I'm going to open the rest of my supplies. And then I'm just going to square up this field and... Alright. So I'm going to make sure that I know where my 1-inch border is. So the 1-inch border at the edge of, or the 1-inch edge is going to be considered non-sterile, and anything hanging off of the table is also non-sterile. At this point, I am also going to make sure that I have all the supplies that I need within my sterile field. So I'm going to open any gauze or swabs that I need right now up and away from the sterile field and just drop them in. And I'm going to, when I drop them in, I'm making sure to keep them in the sterile field and away from that 1-inch border. Got 4x4 sterile gauze, some 2x2s, and then the Superflux gauze for the packing. And then some sterile swabs. Oh, sorry, and that should have been up and away from the sterile field, not right over it. I'm also going to place my measuring tape at the top for when I measure the wound. And then that's a bit within the 1-inch field, so anything past that is, so the area where the ruler is touching is also non-sterile at this point. And then I'm taking out this sterile swab, and I will make, since I've touched this end already, I'm going to make sure to place it outside my sterile field. Alright. And then, since this area of the swab is sterile, I'm going to use it to move around any part of my kit that I need to, and I'm going to use it to grab my forceps. And I'm going to use that to grab my gloves. And just basically rearrange my work area to be a bit more convenient. And before I get started, I'm also going to pour my solution, saline solution, into this cup so that I have it ready for when I need to do packing. Alright, and then for the gloves, so I'm going to open up the gloves carefully and then make sure to only touch the flaps here. Alright, Alright, when donning sterile gloves, I'm going to make sure, I'm going to get my dominant hand first. I'm going to make sure to only touch the inside of the glove and then slip my hand into the glove while avoiding touching any other part of the glove, especially the outside. And then pull it over my wrist. And then for the other glove, I'm going to, since this hand is sterile, I'm going to just slip it in under the cuff. And then make sure that my thumb is away, and then slip my other hand in, making sure not to touch any other part of the glove. And pull it over my wrist. Alright, next I am going, and then now that my hands are sterile, I can touch anything within this field. So first I am going to dry the wound. Actually I am going to clean the peri wound, which is just the area outside the wound. I'm gonna soak, so just dampen my gauze in the saline solution and clean the outside. And again on the other side. And then I am going to dry the inside of the wound first, so just get this gauze and then mop up any excess saline solution from the irrigation. And then I'm going to use these 2x2s to dry the peri wound. So alright, after I am done cleaning and drying the wound, I am going to assess the wound's appearance, and then measure. So the wound's appearance is, the wound is red and moist, and it looks like the texture, there's some bumpiness there, so there's also signs of granulation. And then the peri wound, or the tissue around the wound, there's no signs of redness or irritation, no edema, no necrosis, and no foul odors. And then I'm going to measure the wound by using this swab. So the length is 5 centimeters. 5 inches. The width is 2 inches. And then the depth is 1.5 inches. Alright, next I'm going to pack the wound. First I am going to soak the fluff gauze in the saline solution. And then I'm going to fluff it out, so just get it nice and then I'm going to use the swab to gently pack it into the wound, making sure that I have all the surface area covered. Alright, and then I'm going to cover the wound completely with a couple of 4x4 sterile gauze pads. So here's 1, 2. Alright, and then I'm going to cover the whole thing with an abdominal pad. And at this point, since I've touched a non-sterile item with my glove, my hands are no longer sterile. So I will be making sure to only touch the outside of the abdominal pad, which is marked with a blue line. And then I'm going to just tape that down. Alright, after the abdominal pad is taped down, I'm going to dispose of all my equipment and supplies as dictated by the facility's protocol. As well as remove my now non-sterile gloves. Alright, now I would perform hand hygiene one more time. And then make sure that the patient is, oh, just a note, I forgot to remove the gauze, the disposable blue pad. In real life, I would remove this sooner when I was disposing of all the other stuff. Sorry about that. Alright, so now that, so after I have disposed of the equipment or the used supplies and washed my hands and performed hand hygiene, I would make sure that the patient is in a comfortable position, leave them with a call light and the bed in the locked and in the lowest position. And then I would also document my findings on the wound's appearance, how big it was, the drainage, the type of dressing used, as well as how the patient tolerated the procedure. In this case, I would say that they tolerated it pretty well. Yeah. Oh, and sorry, I forgot one more thing. So before I document, I would also note the date, the time, and initial my name, and then make a note of it on the dressing so that they know, so that the next person who comes in knows that when the dressing was changed and who changed it. And that concludes the video. Thank you for watching.